Alrighty. Welcome, ladies and gentlemen, to the APhA ASP webinar week focused on the policy vice presidents. I want to welcome everybody tonight and to let you know that this session is being recorded for a later date if you would like to come back and review everything. But my name is Dylan Atkinson. I'm the current APhA ASP Speaker of the House, and we're going to get this thing started. So just a few procedures about using the webinar. If you would like to, we do encourage you to use your telephone if you would like to listen in on the webinar. You can dial the number listed on the screen, and then it'll prompt you to put in a code followed by the hash sign. If you would like to use your computer, mic, and speakers, there's also an option for that one. We just do ask that you use some sort of headphones to prevent any sort of feedback in case you do get unmuted and called on at any point. And just be mindful of it. Make sure that you mute yourself after you become unmuted. Everybody should be muted for the majority of this, but at the end when we go to questions, if you do become unmuted and we forget to mute you again, if you guys could help us out and, mute, and press the mute button out of respect for everybody else. And then if anybody does have any questions, there actually is a question box within the GoToWebinar control panel, and you can type in any of your questions as the webinar is going on, and we can address them all at the end. Or during the Q&A portion, you can actually press the raise hand icon. And once you do that, one of us will be by, we'll unmute you, and we'll let you know that you're unmuted, and you'll be able to ask your question for everybody. So those are kind of the two ways that you guys can ask questions throughout it and just be following along with the PowerPoint. So tonight, your hosts are going to be Keith Marciniak, the APhA Senior Director of Student and New Practitioner Development, and myself, Dylan Atkinson, the APhA ASP Speaker of the House from the University of Pittsburgh School of Pharmacy. And also joining us, we have the members of our Policy Standing Committee. So we have Jared Fry, who's our Policy Standing Committee Chair, Adrian Simmons from the Virginia Commonwealth University School of Pharmacy, Evan Colmenares from the UNC Eshelman School of Pharmacy, and Mary Bradley from UAMS College of Pharmacy. So just to get things started, we're going to start things off with a poll here. If everybody could take a minute to bubble in, just what is your role within your APhA ASP chapter? We have a few options there for you guys. If you don't mind taking about a minute to, or 10 to 15 seconds to fill this one out, sorry about that. It would really help us gauge kind of what our audience is tonight. So we're going to open that up for you. Alrighty, we've got just about everybody. A few more. Alrighty. Well, thank you everybody for voting. The results are going to be shown on the screen. So we've got about 60% of you guys are your policy vice president. We've got a few presidents and president-elects, some state association liaisons, and we have 20% of you guys are actually other officers or chairs for your chapter, which is great because we do encourage everybody to come out and view and listen to as many of the webinars as possible. So just to start things off, we kind of want to do a rundown of everything that's going to be happening tonight in the webinar. So we're going to start things off with our presidential theme, which is Together We Can, from Kelsey Gallegos, your APhA ASP National President. Then we're going to move into a little bit about the roles and responsibilities of the policy vice president and tackle this issue of policy versus advocacy and the two things that really go into the position. When we're talking about policy, we're going to dive first into the chapter level and kind of go through the policy development process and how that whole thing starts. And then we're going to take it back and we're going to move on to the regional level and focus more on what happens on the mid-year regional meeting level. On the advocacy side, we want to talk about what you can do locally, statewide, and on a national level. Locally, we're going to be tackling voter registration drives, which is an initiative that we would really like to see happen this year. Statewide, we're going to be talking about what you can do with your state association. And nationally, we're going to be talking about things like the Pharmacists Provide Care campaign, Back the Pack, and we're going to be mentioning the Advocate Training Series, which is still a work in progress at this point. We're also going to go through some of the resources available for you guys as policy vice presidents and chapter members who are just interested in policy and advocacy. Then we're also going to touch on staying connected, some student outreach, and then we're going to have some time at the end for questions. So to start things off, we really want to tackle the presidential theme of Together We Can. So your APhA ASP National President came up with this theme kind of to address the way that you know, individually we all do really great things. But in order to make a huge movement, we have to work together, and we all have to work together doing these amazing things to make an even larger impact. So we're going to be tackling kind of how you as a policy vice president and a chapter member can kind of fill that role within your chapter and within APhA ASP nationally to really show the strength that we have, and together we can. So with that, to start us off, I'm actually going to pass it over to Adrian Simmons to kind of talk about some of the roles and responsibilities of the policy vice president.
Thank you, Dylan. Hi, everyone. My name is Adrian Simmons, as Dylan mentioned. I am a third-year student pharmacist at Virginia Commonwealth University School of Pharmacy, and we are going to begin the official portion of tonight's webinar by discussing the roles and responsibilities of the policy vice president. Although there's a great document on pharmacist.com that details the purpose and responsibilities of the policy vice president, this position can really be summarized in a few words. Your primary responsibility as policy vice president is to engage your chapter members in policy development and professional advocacy. Sounds simple, right? But the purpose of these 10 words isn't to undermine the importance of the position. The empowerment and voice of student pharmacists truly begins with you, so I hope that you take pride in knowing that you play an important role in the professional development of the Academy. Just to name a few roles and responsibilities, policy vice presidents are charged with guiding your chapter through the policy development process, with serving as chapter delegate at the mid-year regional meeting and APhA annual, and leading policy and advocacy events at your chapter. Their roles and responsibilities may vary between chapters. Feel free to visit pharmacist.com for a more exhaustive list. Now that we've talked about specific roles and responsibilities of policy vice presidents, let's zoom out a bit to discuss the big picture. Policy and advocacy are likely the two most common buzzwords you'll hear while serving in your role as policy vice president. However, it's important to understand that there are two distinct words. We'll spend the next couple of minutes discussing what exactly each word means and how you can provide clarification for your chapter members. There's a common misconception that policy and advocacy are one and the same, and that misconception makes it difficult for your chapter members who may not have any experience in either realm to understand how they can contribute in this capacity. Confusion typically occurs at the very basal level of the definition. As a result, this may lead to unintentional intimidation that could prevent them from getting involved with either the policy development process or advocacy efforts at the state and federal level. As the chapter policy vice president, it's your responsibility to clarify these two terms in a manner that your chapter members can relate to. By explaining what the differences in the terms are, you may spark an interest in advocacy from an outgoing person who's passionate about a specific topic, or gain involvement from a more soft-spoken, intuitive member on the policy development front. Be sure to define these terms for your chapter early on in the semester to eliminate any barriers to involvement, and always remember to stress that both policy and advocacy play a vital role in the advancement of the profession. Now let's actually define the two terms. Policy is creating statements about what you, your organization, and/or your profession find important and pressing at this time. They should be continually reviewed to ensure they are still representative of the groups of people who adopted them. For example, at APhA Annual, the APhA ASP House of Delegates passed Resolution 2016.1 that states, APhA ASP calls upon all stakeholders to take measures that create an environment that prioritizes the safety and security of patients and pharmacy personnel. This resolution, or policy if you will, clearly defines the Academy's stance on a particular issue and can be referenced when needed. On the other hand, advocacy is the act of taking these policy statements or beliefs and sharing their importance with others. An example of advocacy would be our annual Hill visits that many of you participated in during the Summer Leadership Institute in Washington, D.C. just last month. As you can see, policy and advocacy go hand in hand. I cannot overemphasize the importance of them both, but also strongly believe it's important to recognize how they differ. I hope this provides you all a bit of clarity, and I look forward to hearing how sharing this with your chapter impacts their involvement. I'll now turn things over to Evan to share some additional information regarding the policy realm.
Thanks, Mary. Sorry, Adrian. Wow, that was bad. But again, my name is Evan Colmenares, and I'm a final year student pharmacist at the UNC Eshelman School of Pharmacy in Chapel Hill. And now I'm going to talk a little bit more specifically about the policy development process and how You as a policy vice president or even as a general chapter member are vital to this process overall. So really the key part of the APhA ASP policy process is it starts with one member and one idea. It doesn't have to be a final year student, a student in an official leadership position. It can be that first year student pharmacist who's fresh out of orientation that has an idea of how to make the profession better. And the goal of the policy process is to take that idea, refine it, figure out if it's representative of the academy, and move it forward through each of the steps. And so one of the things, kind of like I just said, it can be as early as a first-year student pharmacist. It's never too early to start brainstorming. I know some people in my region, as soon as they see kind of what was popular at MRM and at annual meetings, start thinking of what's kind of up and coming, or they're always sharing news articles that are pertinent to pharmacy. So for example, in Region 3 last year, one of the biggest topics was pharmacy robbery. And there were so many news articles, especially in the East Tennessee area. And so that became a proposed resolution for our region. And so really any idea can be a potential policy statement. And make sure you're engaging your entire chapter in this process. This isn't your job as the policy vice president to come up with the idea. You should be helping foster the ideas and helping the chapter effectively select which idea may be the best to move forward. But it shouldn't come down to you if no one else, has an idea. So kind of the beginning of the policy vice president's role in the policy process is to develop the proposed resolution statement that's going to be submitted for MRM. And so this is a preview of one of the infographics that we've been creating as a policy standing committee to help chapters and policy vice presidents more easily explain and share the policy process. But basically, as you can see, it just starts with gathering chapter members together to brainstorm ideas, and then kind of choosing your two top ideas to move forward. And so a lot of this will be spelled out in my next couple of slides, but we're hoping to have a few of these different infographics that you can use to share at your chapter meetings, or even for your executive board that may be less familiar with how the policy process works, or maybe think that they're not policy people. But remember, it's all about that idea. Maybe you as the policy vice president, your main job is wordsmithing and writing the policy and looking up the background statement. But you can't come up with all the ideas yourself. So really the policy development process should be starting now, right when classes are starting back. So for some of you that may be now or last week. I know some people aren't starting back until the beginning of September. But just to give you a tentative outline for now, and your regional delegates will definitely be in touch with more concrete dates based on what region you're in. But 4 weeks before your MRM date, which we will share later if you have available with you right now, your primary and secondary proposed resolutions will be due to your regional delegate. Your regional delegate will then take all those resolutions together, contact any schools that may have similar resolutions that may want to work together, and actually host a webinar like this to discuss all of the proposed resolutions for that region, both the primary and the secondary. So that's an opportunity for each school to get feedback and find out what people like, what people don't like, what may be challenges about or strong support for, and further improve the language of their resolution or the idea behind it, or maybe clarify something. So then you have a week to fix all that language and resubmit one single final proposed resolution from your school to the regional delegate. And then they will get that together, and 1 week prior to MRM send a packet of all of the final proposed resolutions to the region that will be discussed on at the actual MRM sessions. So also an important thing about MRM is the opportunity to run for regional office. There are 3 regional office positions: the regional delegate, the regional member at large, and the regional mid-year regional meeting coordinator. And so if you have any kind of interest whatsoever in running for a position, I highly recommend you do it. I'm a prior regional delegate for Region 3, and it was definitely one of the best opportunities I've had while in APhA ASP. And so if you have any questions about it, you think you might have any interest in it, reach out to myself, anyone on the policy standing committee, anyone on the NEC, Keith, or any of the other APhA student development staff. We would be glad to hook you up with someone based on whatever your interests are. Or if you even know, if you even think there's anyone in your chapter that may have that interest, please tell them to consider it. It's definitely something that's worth it. Even running and losing, you still meet so many great people and have such a great opportunity just by putting your name out there and getting people to know you. So just to put out there some information about registering for MRM 2016, we're hoping the registration will go live in the next couple of weeks, but Region 1 and 3 will be October 14th through 16th, Region 2 and 7 the weekend after that, and then Regions 4, 5, and 8 the last weekend in October, and then Region 6 November 4th through 6th. And so of note, it's a $125 registration fee for APhA members, and there is a registration deadline 2 weeks prior to event start. But something I do want to impress upon you is that some regions do fill up before that 2-week deadline. And so register early, get your chapter to register early, but if you want to go, just register immediately if you already know you're going, because there's nothing, no reason not to, and there's always the chance that the MRM may fill. Because we make them as large as we can based on hotel sizes and capacity, but sometimes we just have way more interest than that. So now I'm going to pass it on to Mary to talk about working with your state association, or potentially Jared, actually. Sorry about that.
Thanks, Evan. Hi, everyone. As Evan said, my name is Mary Bradley, and today I'm here to talk to you a little bit about state association involvement. Evan, would you mind proceeding to the next slide, please? All right, so state association involvement is highly rewarding. Each state has a unique scope of practice that's set by your respective Pharmacy Practice Act, which is in turn determined by your state's legislative body. So your state association is basically your representation and advocate in legislative issues, specifically in shaping your scope of practice. Involvement as a student pharmacist is key to being integrated in the process early and offers many opportunities for you to have a hand in the future of pharmacy in your state. Just as an example, in Arkansas, I serve as one of the 2 student pharmacists on the board for the Arkansas Pharmacist Association. My role basically is to serve as a liaison between the association and student pharmacists at my College of Pharmacy, and to really be their voice on the state level and making sure that we're being heard in all the legislative efforts as well. So there may or may not be a position like this in your state, but I definitely encourage you to pursue any level of involvement that you can initiate. Reach out to your state association and really see how you can get involved. Ask about projects, advocacy efforts that they might need help with. Basically, find out any way you can be of assistance and get involved. As a student pharmacist, we have a unique perspective definitely to bring to the conversation, and most definitely don't be shy, because the state association work now determines how we practice in the future. So definitely take the first step and get involved. And I will pass it on to Jared for the Pharmacists Provide Care campaign.
Hi everyone, my name is Jared Frott. I'm a 4th-year student pharmacist at Wingate University. I just want to give a quick update on provider status, so if you can go ahead and switch to the next slide for me, please. So as you may know, there's currently one bill in Senate known as Senate Bill 314, and also one bill in Congress, HR 592. This allows pharmacists to be reimbursed under Medicare Part B for the services that we provide in areas that are considered medically underserved. The scope of services that pharmacists can provide is based on the respected state's scope of practice, which we'll hit on a little bit later. Also, we currently have 291 co-sponsors for HR 592 and 49 co-sponsors of Senate Bill 314. Which this campaign would not be nearly as successful as it is today without student pharmacists like yourself who help educate your Congress, community members, and fellow student pharmacists. So thank you for all the time and energy that you've put forward toward this important issue. Also, if you haven't already joined the campaign, I strongly encourage you to do so. PharmacistProvideCare.com has numerous resources available that will help educate you, your chapter members, and the citizens of your community. And if you go to PharmacistProvideCare.com and click Get the Facts, as you can see on this page, you'll be directed to a page that also has Student Pharmacist Toolkit. This toolkit has a lot of information that's very useful that you can distribute to your chapter members but also to the community as well. Another resource I found that was very helpful for my chapter and for me to really show my community the impact pharmacists can have if this bill gets passed is utilizing the state-specific information, which can be found at the main page at pharmacistprovidecare.com. And I'm going to turn this back over to Dylan.
Thanks, Jared. So this next one that we're going to talk about is Back the PAC. So for those of you who don't know, the PAC is the Political Action Committee through APhA. And the goal of it is really to protect and promote the profession. The mission is kind of just to support candidates on the federal level who have demonstrated support for pharmacist issues and recognize the true value of pharmacists in the healthcare system. This is usually done by pooling funds to support pharmacy-friendly candidates, but it has to be done by APhA members. So your role as the PVP is to kind of help your members understand the different donating rules and help manage different fundraising activities. We have some great resources on pharmacist.com that can help you out with this, and they detail all of the different rules that come along with being a political action committee. In fact, one of the things that you can do as your policy vice president is the Back the PAC challenge. So this is your way as a student pharmacist to kind of help give pharmacy a voice. Evan, if I could have you go on to the next slide, please. So through the Back the PAC challenge, it's actually an annual fundraising challenge to help raise money for the APhA PAC. And last year we raised just about $15,000 through the Back the PAC challenge, with the top chapter that donated being the University of Florida. So it's actually a competition between the chapters to raise the most money, and the top 5 chapters are going to be recognized at APhA 2017. So this is really your opportunity to make sure that pharmacists have a voice, and our champions stay our champions in Congress. This year, more than any, it's incredibly important to get involved with the PAC, simply because this is an election year, so we're going to need to make sure that our pharmacy champions stay there for us and can continue on with whatever legislation we have coming up. So with that, I'm actually going to throw it back to Mary to talk a little bit about voter registration drives.
Thank you, Dylan. And definitely we appreciate everyone's patience as we kind of toss the ball back and forth. So voter registration drives are really the ultimate way to advocate. It gives you a voice as a citizen, and in turn, organizing drives is a really great way to ensure that those in your community are also being heard, especially your peers, your student pharmacists that you're working with every day. So this is a great way to get your chapter members involved. Some things to keep in mind. Definitely keep the planning process simple, but make sure you have the logistics worked out. There are a lot of really great resources out there for you. You might notice that on the right-hand side of your screen, there is a little tab that says Handouts. And under How to Plan a Voter Registration Drive, there are some great information and some great tips to plan any voter registration drives that you might be working on or thinking about. Something very specific that is often not talked about a lot are state-specific regulations, and these are very important to keep in mind whenever you're planning your voter registration drive, because each state has very different regulations. Some of them have ID requirements. Some states require reporting mandates, so you have to turn any forms that you've collected in by a certain number of days. So in Arkansas it's 30 days, but there are some states that it's as little as 2 days. So a great resource for that is the State Restriction on Voter Registration Drives document that is actually published by a law school, and they went through and documented all of the state's restrictions. So use those to whatever extent you'd like to, and we'll work on getting those put up on pharmacist.com as well. And this is a really unique opportunity for you guys as policy vice presidents to engage your chapter members, as it is an election year. So get them planning some voter registration drives and get out in the community and really work to make a difference this year. Thanks, guys, and I will pass it along.
Hey everyone, sorry about that. So the Policy Standing Committee is working very hard at getting infographics created which will help you present information to your chapter in an easy-to-read form. As you've seen earlier in the development process of MRM, there's an infographic created, and this was created by the Policy Standing Committee. And we want to continue to emphasize these throughout our position as members of the Policy Standing Committee. Also, we are working to create easy-to-follow documents which will detail out action items on ways to help improve, to move your state forward. This is really because if you think of provider status as a whole, it comes down to the state specific. And we need to really move forward the states now rather than later. So be sure to be on the lookout for these. If you haven't already visited pharmacist.com, I highly suggest doing so. It has a lot of valuable resources available to you, and the capsule is a great way to truly dive into the policy process and is necessary to really understand as a policy vice president as well. Also, if your chapter does anything you feel like would benefit other chapters, be sure to submit these ideas to the chapter cookbook. And as always, the Policy Standing Committee and regional delegates are always here to help you if you have any questions. Evan, can you move the slide forward for me, please? Thank you. So these are your regional delegates, and the past slide was the Policy Standing Committee members. Reach out to any of us. We are here to help you. Utilize us as much as you can. The policy process can seem very hard to really understand at first, but once you understand it, it's a wonderful aspect and easy tool and a way to really engage your chapter members. So I'm going to turn it over to Dylan to take over from here.
Thanks, Jared. So this fall, as with every fall, the APhA National Executive Committee and the APhA Student Development staff are going to be conducting our APhA student outreach visits to the different APhA ASP chapters across the nation. So this is really your opportunity to get somebody from APhA into your chapter to talk about things that are happening on the national level, to kind of gauge a feeling about, you know, what can you do at your chapter to reinvigorate the feeling of involvement, to get people involved in your APhA ASP chapter. If anybody is interested, please go to the link there just to find out some more information, or you can even sign up to have your chapter have a visit. This is a great way to kind of get some new members and to get people really involved right off the bat with APhA ASP, and even to introduce them to the whole policy development process and to kind of get those gears turning for the future. Next slide, please. And then one of my favorite ways that you can actually use your advocate abilities is through the PharmFlix competition. So PharmFlix is your opportunity as student pharmacists to create a public service announcement that's 90 seconds or less. And these can be funny, they can be serious, they can be informative, they can be anything you want them to be. But we do have them all focused around this Together We Can theme. So there's actually 3 categories that your video can fall into, and they're most humorous, most informative, and best overall. And these are all voted on by your peers at the APhA ASP House of Delegates, which is going to be in San Francisco this year. So this is really your opportunity to kind of show the rest of the APhA ASP Nation what you've got, and really show what pharmacists can do through this Together We Can. The deadline for chapter submissions is right there. It's December 1st. And during the House of Delegates, you'll have your opportunity to vote for whichever ones you think are the most humorous, informative, and best overall. Next slide, please. Another thing that we really want to encourage is to stay connected. Follow us on Twitter, watch our YouTube channel, follow us on Instagram, like us on Facebook, use hashtags. We're always looking for new provider status champions, and we love to see what you guys are doing. And we're always looking for things to highlight on the national Facebook page, so you could be next. Anytime that you do something, if you go out this weekend or this week and you meet with your legislator in your hometown, take a picture with them, throw it on Facebook with hashtag Together We Can, hashtag provider status, and we'll find it, and we'll more than likely we're gonna show the rest of the world what you guys are doing, because it's so important. And then also we want to encourage everybody to make sure that you jump in on other webinars. I mean, 20% of our attendees tonight were not policy vice presidents, and I think that that's fantastic. These webinars are really focused around you guys to get as much out of it as you want to. You don't have to be one of these vice presidents to get involved with them to learn a little bit more about APhA, ASP in that field. Tomorrow we've got membership and communications, and then Thursday we have finance and patient care. So really hope to see all of you guys there. And with that, I'd be happy to take any questions if you guys have any. You can use the raise hand function, or if you would prefer to type them out, you guys can type them out over on the side there. It looks like we have started to get a few questions coming in. So to start things off, I have a question from Peter here, basically asking about ways to engage the chapter in the policy development process, especially as a new chapter. So I'm going to throw this one out to you guys. Does anybody have any ideas with this one?
Sure. So, hey, Peter, this is Evan again, one of the members on the Policy Standing Committee. I think that one thing that a lot of chapters do, which I know for a new chapter, it kind of all depends on your budget, is try to host a pizza and policy event where they, work on policy statements, but really get people excited by offering free pizza. But, in lieu of that, something that our policy vice president did that was very popular was she went through the capsule or the adopted resolutions policy book and found policy statements that were on the books from the 70s, 80s, 90s that actually correlate to things that we're doing today. So one example I have is there's a adopted resolution about non-prescription drug education or OTC education. And so she made a example that said, in 1972, 73, the students said they wanted education on non-prescription drugs, so now we have this course that's required for all students in our school. And just kind of finding ways to make it more connectable and relatable. I know that kind of these days, like for example, pharmacogenomics was recently one of the resolutions that was passed kind of at the national level in the past few years, and point of care testing. And some of those seem, really lofty now, but you have to remember that 30 years ago, these ideas were just as lofty then. And so, just making it really connectable, relatable. Something else she did last year was have monthly topic discussions just about a hot topic in pharmacy. So she didn't market it as policy related or advocacy related, but it was really just a, come talk about this hot topic in pharmacy practice, pharmaceuticals. For example, one was based around marijuana legalization. And so that's something, if you pick a hot topic, everyone's going to come, put their idea into it, make their opinion heard, and it's kind of like sneaking in policy and advocacy. So you can kind of maybe come up with those ideas by hearing what your students in your chapter are passionate about.
Thanks a lot, Evan. We have another question here from Kimberly asking if there's going to be a policy postcard challenge this year. So does anybody want to take that one?
Yeah, I'd be happy to. This is Jared. So the policy postcard challenge, we are not actually continuing the challenge this year. However, we are encouraging you all to continue the actual policy postcard and sending those to your Congress and senators. But as far as the challenge, that will not continue this upcoming year. Thank you all.
Thanks, Jared. We do encourage you guys, if that's something that works for your chapter, to continue doing them, but we will not be having the challenge for that one this year. So I have another question from Matthew as to, is there an electronically searchable version of the adopted resolutions? There is. It's on pharmacist.com, and you can find it under the Policy and Advocacy tab. You can also find the entire capsule, which has the entire process of the policy development process within there with that. Alrighty. It looks like we're getting a few questions coming in now. So there seem to be a few questions about the policy postcards in regards to the challenge. So we don't have the policy postcard challenge anymore. However, we should still have the template for the postcards online. So if you would like to print them off and use them at any of your events. However, we are not going to be having the challenge so much anymore. They should still be there, and there is some information about the challenges, and as we're updating pharmacist.com, we'll kind of be revising that one a little bit. But we do have several different versions of the postcards available for printing. We have them in black and white if that helps better for you, and we also have them as the front and the back, depending on however your printer setting is set up. So I got a question here about infographics available about different pharmacy stances in regards to the upcoming election. So would anybody like to take that one?
Sure, Dylan. So in response to that question, at this point, we don't have any infographics made, but we would love to hear everything that you guys, would really find beneficial, and we'd be happy to put one together for you guys to distribute to your chapter members and get that to you guys pretty soon. Just let us know what all you need, and we'll be happy to, make sure it happens for you.
Thanks, Mary. So I have a question here about the PAC and any sort of regulations for fundraising about the PAC, since it is a political effort, and what kind of fundraising can you do to fundraise for the PAC? So this is actually a really good question, and we have a lot of information on pharmacist.com about this one. But the PAC, there are a lot of regulations around it because it is to help with elections. So the federal election, the FEC kind of steps in, and they have a lot of barriers up about it. So the biggest thing is that anybody who donates has to be a member of APhA or APHA. So in order to donate to the APHA PAC, you have to be a member of APHA. But that makes sense because we're all student pharmacists and we're all pharmacists, and we're all members of APHA anyway. But in regards to actually fundraising the money, there are specific rules about how much you can donate through cash versus how much you can donate on check. The rules go up to $50 you're allowed to donate through cash or check. However, any donation above $50 has to be written by check. And once again, anybody who donates has to be a member of APHA. Another thing that you can do is you can actually send out flyers and circulars and things like that to your membership and kind of encourage them to join the Back the PAC Challenge. However, there is a disclosure statement that you have to put on there for any kind of public information that you might be putting out there to make sure that people know that this is for members of APHA and this is kind of what the PAC is. So I do encourage you to go to pharmacist.com and find the information for Back the PAC. It's once again under the policy and advocacy page, because there are some rules around the Back the PAC campaign, but overall the big ones are that they have to be a member of APHA, and donation counts. It's just if it's over $50, you do have to write by check. And APHA actually does have a donate by phone method, so you can actually text in to give any kind of donation. So what we found to be particularly successful is to have people donate the $5 through sending a text message. I mean, that's really just a cup of coffee one day. But on the flip side, you're helping save your profession and you're helping move pharmacy forward. So I do encourage you to go to pharmacist.com and kind of look at that information. If you do have any specific questions, you can contact myself or anybody on the Policy Standing Committee, and we'd be happy to help point you in the right direction for any of that information. But great question. Thanks a lot. I got a question here about FarmFlix. FarmFlix is still happening. The deadline submission is going to be December 1st for this one, and the theme is Together We Can. So FarmFlix, for anybody who tuned in a little bit late or maybe wasn't paying attention so much, is an opportunity for you as a student pharmacist to kind of create a video, a little bit of a public service announcement to kind of show what pharmacists do using the theme Together We Can. And what's really neat about FarmFlix is you can do whatever you want with it. You can make it as funny, as serious, as heart-wrenching. It might make me cry. Whatever you want to do with the video. Thank you so much. And then at the annual meeting, you actually vote on the most humorous, the most informative, and the best overall. So thanks for the question. I also got a question about the infographics, about what infographics do we already have in general. So all of the infographics that we have now are on pharmacist.com, with the exception of the one that you saw within the slides here. Because as we're currently updating pharmacist.com and the Policy Vice President Toolkit especially, we're kind of going through and finding how can we condense some of this information for people to kind of get the point across in a little bit of a better way. So this one is just one of the ones that we've been working on. We're going to be rolling a few more out. But if you do have any ideas for infographics, especially pertaining to APhA, ASP, and our policy development process and anything like that, definitely start making them. Let us know. If you guys do, send them in to us. We'd love to see them. Submit them for the chapter cookbook, along with any of the ideas that you guys have had for any kind of events that you found particularly successful. Alrighty, and does anybody have any other questions? I believe that we tackled all of them. Alrighty. Well, if nobody has any other questions, we will get wrapped up here. So thank you all for tuning in tonight. We really appreciate it. Be sure to check out all the other webinars that are going to be happening this week. We've got a lot of really great ones. For anybody who is just on the international one, you know what I'm talking about, and there's the schedule. It'll be posted all over Facebook, so keep an eye out for it. And definitely let us know if you have any questions or anything, if anything comes up. But thanks again for spending your Tuesday night with us, especially everybody on the East Coast, because I know it's getting pretty late and past some people's bedtimes. But thanks so much. This will be posted on our Facebook page a little bit later. So thanks again, everybody. Let us know if you have any questions.